Dry mouth or xerostomia happens when the glands that produce saliva aren't working well, and it's sometimes a symptom of another condition. Dry mouth can be very uncomfortable, especially when it's recurring, and treatment for dry mouth depends on what is causing the problem to begin with. In this video, I'll go over what causes dry mouth, 2 products that seem to get the job done for most, and 5 ways to prevent it, so stay tuned till the end. Hi guys, you've seen Humidifiers here on YouTube. This week's video is on dry mouth or xerostomia. If you haven't already, smash the like button below now, as there's a ton of useful information in here that I know you could benefit from. Also, while you're at it, hit that subscribe button too to stay up to date with new weekly videos. And without further ado, let's talk about that dry mouth. Almost everyone's mouth is dry sometimes, so it can be normal to have it occasionally. But if you feel like you always have, let's say, cotton in your mouth constantly, it may be time for some treatment. Not treating dry mouth will make it difficult to speak, chew, and swallow, and can even alter the taste of your food. It can also cause a sore throat and even bad breath. What are the causes of dry mouth though? The main causes are aging, smoking, snoring or being a mouth breather, hormone changes, diabetes, chemotherapy, and certain medications that are known to cause a dry mouth. According to the Surgeon General's report on oral health on America, dry mouth is a side effect of more than 400 prescription and over-the-counter drugs, such as antidepressants, antihistamines, muscle relaxants, and high blood pressure medicines. But with that said, please do not stop taking any medications that your doctor has you on, even if they cause a dry mouth, as this can be harmful to you. Always consult with them first before making any changes to your medications. Now that we know some of the causes, let's get straight to the 2 products that I recommend to patients when they come in at the pharmacy. Number 1, the biotene dry mouth oral rinse. It freshens the breath, it's alcohol and sugar free, and it soothes and moisturizes for up to 4 hours and can be used up to 5 times a day. The number 1 thing I like about it is that it provides a balanced pH in your mouth. Speaking of pH, the first concern I always have with dry mouth products is that if they're too acidic, yes, they can provide that relief, but if you end up going back to square one with all that acidity, this can increase the risk of decay and encourage bacterial overgrowth in your mouth. Biotene is not too acidic, and it comes in a gel and spray formulation too, which is even more convenient. And number 2, Xylamelts. Xylamelts contain xylitol and an oral moisturizer to coat, soothe, and moisturize the mouth. What's awesome about it is that it comes in as an oral adhering disc that sticks to your teeth or gums to relieve persistent dry mouth. Use it during the day or while sleeping to put a hold on all that bacteria that tends to grow in the mouth. It also reduces plaque, and it reduces the risk of decay at the same time, which are all bonuses. Personally, I'm a big fan of Xylamelts, as it has helped me overcome the dry mouth that I get with some of the allergy medicines. Links for the products are in the description box below, so don't forget to check those out. Pilocarpine or Saligen and Cevimeline or Evoxac are prescription medications that stimulate the saliva production and are both used to treat dry mouth by stimulating the flow of saliva to your mouth. Talk to your doctor if your symptoms of dry mouth don't go away to see if any of these medications are right for you. Now that we got the treatment out of the way, I'll share with you 5 things that you can start doing now to prevent dry mouth from coming on. Number 1, avoid dehydrating products. The first of them is caffeinated beverages, as these can be dehydrating. Studies have found that drinking caffeinated coffee or tea causes dry mouth. Also limit the amount of alcohol use. Alcohol may dehydrate in certain people, which can contribute to dry mouth. This is why it's best to avoid alcoholic mouthwashes. Next thing is smoking. Cutting down or quitting may reduce the dry mouth symptoms. Number 2, avoid breathing through your mouth. Your only other option is to breathe through your nose, and I know that this can be very difficult for most, including myself. You may need to seek treatment for snoring if it causes you to breathe through your mouth during the night too. Click the video on the upper right hand corner for tips to beat snoring, as it ties back to preventing that dry mouth. Number 3, sip water or sugarless drinks throughout the day, or even suck on ice chips, as this can help moisten the entire mouth. Number 4, unless recommended by your doctor that you take them regularly, avoid using over-the-counter antihistamines and decongestants, because they can make your symptoms worse. If you think that your medication is causing your dry mouth, talk to your doctor and never suddenly stop taking the medication without your doctor's approval first. And lastly, number 5, get a humidifier. Creating humidity may help the dry mouth simply by adding more moisture to your environment. And there you have it, 5 ways to prevent dry mouth that I hope that you take on board. In addition to all these tips, remember to see your dentist at least twice a year to have your teeth examined and plaque removed to help prevent that tooth decay that can come on from dry mouth. So really, saliva plays a huge role for our health. Although it's mostly water, it also contains important enzymes and lubricants that make swallowing and digestion more comfortable. Even more is that it helps control bacteria which cling to our teeth and feed on the sugars that we eat. If we don't have enough saliva, cavities can occur at a faster rate. So please don't neglect getting help for dry mouth early on. I hope this video was useful to you guys, and I hope that you do share it with someone you know who could benefit from it. Like the video if you did enjoy, and subscribe to stay on board with all my other weekly health and wellness videos. Thanks for sticking tuned all the way till the end of this video, and as always, I'll see you on the next one.